Okay, welcome everybody. Hoping that this is all working okay. We've just run a session earlier today at 12 o'clock. That seemed to go pretty well. This one should be even smoother as we've had a practice run. We have a lot of people on the call today, so logistically we need to just be able to manage the technology. I've got a lot of moderators on the call as well, which is fantastic. This session is being recorded, so you can watch it back. So anything that you miss, or if you drop out the call, we will be sending you a link. As I've mentioned, as we have a lot of participants on the call, what I'd like to do is during the main presentations is to ask you all to keep yourself on mute and to keep your cameras off. When after the presentations, I will be splitting you into breakout rooms. When you're in the breakout rooms, you're welcome to put your camera on, but you don't have to, but you're also welcome to unmute yourselves during the discussion. You'll have a moderator in the room who can facilitate that for you. As I say, we just hosted a session earlier and we had 5 breakout rooms and they all went really well and facilitated some fantastic discussion. So I'd just like to go through the agenda for today with you. So what we're doing, we're very, very lucky today to have Kevin Wilson, who's the head of contract tracing service, on the call, who will be discussing the procedures around contract tracing and the implications this has for businesses. We've also got Julie Bradley on the call, who could talk to you. Julie Bradley works at Manx Industrial Relations, and she'll talk a little bit more about employee policies related around COVID, as that's something that we've seen a lot of businesses asking for. Once we've had those quick presentations, we're also going to hear from Tim Cowsall, who's the head of the business agency as well. I'll bring him in first. If everybody could please turn their cameras off, that'd be excellent. Thank you. Once we've had our presentations, I will push you out into moderated breakout rooms, and we'll cover 3 themes: people policy, office policy, and track and trace. The idea behind these breakout rooms is to allow some group discussion, allow businesses to share best practice, but also to talk through concerns and queries that they have. This will give us the opportunity to pull together some really comprehensive guidance, the sorts of things that businesses are looking for. So without further ado, what I will do is hand over to Tim, and Tim, head of business agency, will give a quick overview of the current position that the Isle of Man is in.
Thanks very much, Bex. So thank you all for joining today. It's great to see so many different sectors covered across the call today. I don't know if we were up to about 58, and there's a good range from the island, so it's really great to see. During the pandemic, we've worked incredibly close with business and hopefully developed guidance and support as we've gone on, and now we move on to this next stage of the pandemic and how we live with it. We now want to sort of understand what the issues and potential solutions you as businesses have for going forward. Just to sort of caveat Bex's point, we won't have all the answers today, but we hope you will be better informed and sort of understand best practices from each other to develop it further. A number of different sectors have lived through COVID. The engineering manufacturing sector has worked throughout, and we're hoping that that experience can be shared across the different sectors. But selfishly, from a government perspective, we want to understand what support is needed and where we need to add a bit more sort of communication or understanding from a business perspective to make sure that we can get through the next stages. We're moving to a level of personal choice going forward. So we will move across the different levels. We are ready. You've got the 0, 1, 2, and 3. Well, we're in 0 at the moment. And I understand this does bring some direct challenges to businesses, as it's based on decisions for businesses, but based on individuals. So like Bex said, we're going to break down the workshop today into 3 areas, which is track and trace, employee, and then office and your premises. But hopefully these issues will be cleared up as we've got Julie and Kev here from contact tracing to cover those initial points. But really want to understand how we can support you better today. So thank you very much for coming.
Thank you, Tim. That's excellent. What we'll do now is introduce Kevin Wilson. As I say, we're very, very pleased that Kevin could join us. He obviously is very busy in his role as head of the contract tracing service. So Kevin, I'd like to just give a brief overview of the team, how it operates, how it works, how really, more importantly, how that would affect your business and the way you run your business. I know that you'll have a lot of questions for Kevin, but perhaps it would be best if we collate those questions during your breakout groups, and we will forward those through. If we can't answer them, we will hope to get you the answers. So Kevin, over to you.
Thanks very much, Rebecca. Good afternoon, everybody. Really, I was just intending to give an overview of contact tracing in its briefest sense, but I appreciate the time isn't necessarily with us. So asking the question what contact tracing is actually about, essentially you'll all be aware of 111 and the ability of members of the public to come forward with symptoms they have a concern about, and then they are clinically assessed by a clinician within 111 who makes a decision whether or not to put them forward for a swab and obviously a test. If that test then comes back positive, then clearly that's notified to the individual concerned, and also contact tracing officers are notified. So what happens then? Well, contact tracing officers will make contact with the individual, and essentially what we're going to do is carry out an interview, and that interview is largely centered around 48 hours before the onset of those symptoms, or indeed, if they're asymptomatic, the date of the test. And what we're trying to achieve by that interview is essentially to capture the movements of that person and their individual encounters with people. Why that is important is because we're trying to understand the level of exposure that other people may have had to the virus. And really, we apply a risk assessment to that. Essentially, that's going to be being within 2 meters of an individual for longer than 15 minutes. That can be an accumulated 15 minutes over an extended period of time if there's frequent encounters between them. That's important. Physical contact is also really important. And some of those things might well be around being in an enclosed environment, so a meeting room or a very small office. Some of those things do have an impact with regards to the level of exposure and therefore risk that you may have. So after that interview, we've identified those people. We then go out and the team will look to contact the individuals who have been assessed at high risk. We'll then look to isolate them and then offer up swabs, which obviously then go for tests, and thereafter the cycle starts again. So that's in basic terms, that's contact tracing. Some of the things that we've learned through the outbreaks that we've been dealing with is really what helps us, and ultimately it helps us helping you as well. So some of the things that we've seen is risk assessments, that businesses have prepared themselves for COVID and their COVID specific risk assessments that they've engaged with their staff with, so that everyone's clear on what needs to be done and the potential risks for individual businesses, which could be bespoke to that individual business. The other issue is when the risk assessment's been done, a lot of obviously investment is made in PPE or that ilk. The issue then becomes the public facing side of how the staff use that PPE and adhere to the measures that you've brought in, versus the more non-public facing side, which is what happens in the staff room, what happens in the smoking area, what happens off camera almost. Those are some of the issues that we've come up, and that's been a surprise to some of the businesses, and it's led to people being isolated, and it obviously promotes risk within the business area. And the other one, which is a really important one for us, is illness, and supporting staff to not come to work if they're ill. We've had occasions particularly during the recent outbreak. Some people didn't recognize the symptoms that they did have, but some did have what you might call classic COVID symptoms, but were still operating within the workplace. And that has implications, as I'm sure you'll all be only too aware of. So creating a culture within the workplace that allows people and to feel confident to ring in and say, I am ill, I can't come into work, and encourage them if they do feel that the symptoms are related to COVID, to contact 111 and put their mind at ease, and we know what's going on there. Those are really, really important messages, I personally feel, to get over the staff members. That certainly helps. It helps your business because you understand the risks, but it also helps us as a community identify where this raises its head and enables us to properly suppress any secondary transmission within the community. The whole goal of track and trace and contact tracing, whichever phrase that you want to use for it, is to stop that onward transmission. And that's why we're trying to work really very quickly with people, gain the information that we need so we can stop it from getting any further in the community. And I think that's really what contact tracing is about. I think that's probably it, Rebecca, a sort of quick overview.
Yeah, thank you very much, Kevin. And yeah, I know I'd appreciate you can't cover everything in such a short space of time. Can I just ask you just one or two questions that might prompt some more discussion in the breakout groups? Just something around, if a staff member has been contacted by the track and trace team and asked to isolate, I think one area of uncertainties is whether all the other staff members are obliged to their work from home as a precaution. Where do you draw the line between low risk and high risk?
Right. Well, that I think I'm going to be accused of fudging the issue, but some of that is business decisions. Some of that is around what the nature of the reason that person is required to isolate. So if it's because they've had or have got the disease at the moment and that's been identified, that's a slightly different risk profile, obviously, than someone who's been a close contact of an individual with the disease, but may not have it at that moment in time. So we do get lots of questions about contacts of contacts of contacts and what we should do about it. It should be captured within your plans within your business about how you're going to react to someone who comes forward and notifies you that they have the virus, and that's the reason why they need to isolate. But B, there will be close contacts, and they will only ever be close contacts until such time as they're swab tested and it confirms that they've got the disease themselves. So really, in your planning stages, it would be really useful for businesses to have a response to that, because that will be about the business risk appetite sometimes if it is close contacts only and not disease directly, but we can't really tell businesses what to do. It'll be around a business decision.
Yeah, I completely understand that, Kevin, and I think that's why we're trying to do these workshops, just to help businesses get their heads around that. Now as we move forward in living with COVID, it's up to individual businesses to create their own policies around track and trace and their employees and all of that. So yeah, that's great. Thank you, Kevin. I'll let you go, Kevin. And as I say, what we'll do is we'll ask our participants to drop in any more questions and queries they have when we go into our breakout groups. But thank you very much for your time. What I'd like to do now is bring Julie Bradley in. Now, Julie will talk about employee related policies. We've had a lot of queries around employee policies around COVID, and I know that Manx Industrial Relations has been incredibly busy recently. So Julie, I'll bring you in, and while you're just doing your introduction, I'll pop your slides up onto the screen.
Thank you very much. Good afternoon, everybody. In case you don't know who we are, I'm Julie Bradley and I'm from the Manx Industrial Relations Service, and my job and my team of officers is to promote good working practices and to make sure that people understand and comply with employment law. Our service is always free. We're paid by the good Manx taxpayer, although we're not aligned to the civil service or a government department. So we are completely impartial, and we deal with anybody. You could be an employee, you could be an employee. We often deal with trade unions, and we've got good relationships with all the advocates. So that's us in a nutshell. I'm not going to bore you with what the law says and which section of the law to look at, but I think when we've looked back retrospectively about which laws are most affected or by the pandemic, it's the four you can see on your screen. The principal piece of legislation is the Employment Act, And that will cover things like unfair dismissal, or if you treat employees differently or badly because of something that's happened during COVID. We've also got the relatively new Equality Act, and that could affect discrimination claims. More recently, we've got the flexible working regulations that permits employees, any employee, no matter how long or short a time they've worked for you, to work flexibly. So that could be a part-time working, and it could be more commonly what we're seeing is people making requests to work from home. And last but not least, we've also got the annual leave regulations that have existed from 2007, but the part perhaps about COVID that you need to be aware of is the amendment that was made to the regulations in last year. So I'll just give you, I've got 4 of the most common queries we've been asked about the pandemic, and I'll just sort of skim over those to give you a flavour and perhaps to give you some reassurances that you're not the only people that are being asked these questions. So interestingly, annual leave has been one of the most common questions we've had from both employers and employees in recent weeks. The first question from employers is, can I force my staff to take holidays? And the answer is absolutely you can. That provision has existed since the leave regulations were introduced many, many years ago. And the way you do that as an employer is if you require people to take holidays, you have to give them double notice. So, for example, if you want to make an employee or a worker take 5 days holiday, you have to give them 10 days notice of that. And that's existed forever, and that will continue to exist after the pandemic. The other issue, and this is where the regulations changed last year, Department for Enterprise brought this regulation in, is that if staff have been prevented from taking annual leave in what is their normal holiday year because of COVID, then they are going to be and are permitted to carry forward those holidays into the new leave year, even if your contract doesn't permit that present. And that carry forward will exist for 2 years. So that's the one annual leave issue you need to be aware of. Secondly, and certainly since we've returned to a fairly normal way of life again, staff have found that they like working from home. They've, in many cases, found they're more productive working from home. And for many employers, it suits their needs. So we are starting to see more inquiries around, can I work flexibly, part-time, different days, or can I continue to work at home? And these regulations have existed, again, for a long time. You can, as an employer, refuse a request, and simply the fact that we've proved over the pandemic that people can work from home quite satisfactory, that isn't probably going to be enough for an employee to be able to say, well, I expect to be able to continue to work from home. So there are reasons, and they're clearly set out in the regulations as to why an employer can reject a flexible working request. And it can boil down to a number of things. It could be that you would incur additional costs to allow the individual to work from home. It might be that it would have a detrimental impact on the delivery of your service. So there are reasons you can turn it down, but again, familiarise yourself with the regs. They're fairly an easy read in terms of employment legislation. And if you've got any queries, you can always phone our good service and we'll be able to help you. Third most common question is around terminating contracts. Can I sack people who have been self-isolating? This is the second time or third time they've had to do it, and I'm pretty fed up of it as an employer. The short answer is, if somebody's self-isolating because of a legal government direction to do so, so they've been told to by Track and Trace, by Kev's team, you are not going to be able to dismiss them fairly. And I say that because the truth is, any of us can get sacked at any time. My boss could walk in today and say, you're sacked. But the question always has to be, was that the fair thing to do? And certainly if somebody is self-isolating, the actual answer will be, that's not the fair way to dismiss them. Again, if you want to have a conversation about that, we can talk to you or indeed get some legal advice about it. I've saved the best to last because the most common question we're being asked about is the issue around vaccine. So can I force staff to have it? Can I sack them if they refuse to do it? What proof can I ask for that staff have had the vaccine? So there's a whole range of questions in there. So the short answer to can I force staff to have the vaccine is absolutely no, you cannot, unless you're going to pin them down and jab them in the arm while you've got them pinned down. So you can't. And, it's a human right. We've all got a right to have a private life. and forcing someone to have a jab would contravene that right. So no, you can't force people to have the vaccine. What we are thinking, and this is just our thoughts at the moment, because obviously there's no case law, it's all very new, is that there will be some employers who are going to be able to say, well, it's essential for you to have the vaccine. And the areas we think about quite obviously are any area related to health and social care. So nursing environments, hospital settings, care homes. We think that those employers will probably have a reasonable chance of implementing policies whereby staff can be forced to have the vaccine. We do think that this is one of those areas where you probably haven't got a policy, but it's certainly worth thinking about developing a policy in conjunction with your staff and any trade union representatives you might work with, and take account of any guidance that that exists from public health. We have Industrial Relations put together a little policy, and if you want to have sight of it, it's nothing fancy. We'd be happy to email that to you. The other issue about proof, can I ask staff for proof they've had vaccinations? Again, the answer is yes, but some of them might tell you to get lost and some of them might not tell you the truth. So what we would say is, ask yourself as an employer why you're asking for proof, what's the reason behind it, and what will you do if people don't tell you or refuse to tell you that they've had it or not. The second one is a good issue. And again, this is untested. We haven't got any cases here or in the UK courts yet. But overall, we think that if you dismiss somebody for not having a vaccine outside of the social care settings and the hospital settings, we think there's probably a reasonable chance that an unfair dismissal claim would succeed. So if you are thinking about dismissing people for refusing to have the vaccine, give us a call. There will be a number of people who can't have it for health reasons, though that'll probably be a small proportion. There may be pregnant ladies who don't want to have it. We can talk to you about what to do with that. And there might be people who've had adverse reactions to the first one and don't want any more. So there are cases where unfair dismissal claims are likely to succeed, and we'll have to watch this space as to where they end up. And I think for now, I hope that's given you a brief overview of some of the issues that are floating about that we're getting questions from both employers and employees. And I'm happy to take any questions within the breakout session.
Thank you so much, Julie. That's really, really useful. Thank you. And I will share your slides with the participants at the end of the session. Thank you. Okay, right. So we've all spent 30 minutes in your breakout rooms. So it'd be great if we could just share some of the discussion and the best practice that was discussed in the breakouts. Tim, can I kick off with you? And we'll start with the topic of track and trace first.
I think we were mostly okay on that one, weren't we, Louisa?
Yeah, I don't think we had too many questions really. I think everyone seems like they've kind of got it sorted, and we're doing registrations when people come in and out of the building, and that seems to be sort of general best practice. That's kind of the general thing I got.
Yeah, there were some questions about sort of the 15 minutes, where do you draw the line? Someone's just popping into the front office just to sign something and walk out. So we talked about that mitigation process that you go through with the PPE screen. You've got that at the front of it, they're not going around the building, then that makes a big difference. And having that way where they go and what they want. But one thing that did come out of contact tracing was when people use CCTV for working through that, and is that a use that you can use it for, because it's not on the privacy statement from that. So that's one that we've got to take away, isn't it? That we've got to look at, because I think a bit of guidance and support about how you can use CCTV for contact tracing methods is something that we need to do. And then the other bit was about sort of testing with clients and businesses on a relative basis that they're symptomless, making sure that that's part of your process. If you've got someone coming in for a long time or doing something like that, checking that on the outset, so you're sort of being a bit of a preemptive strike. That's it for me.
I'll mute. Thank you, Tim. Do any of the other moderators have anything to add around the track and trace discussions that they had in their groups? Charlie,
we had them.
First.
Sorry. We had a really interesting chat around data and, data you can collect, data you can't, and around whether or not it's obligatory for people to hand over that data, and what kind of controls and measures you can have in place, i.e. if you've got guests coming in who are unwilling to give that information, is it okay for a business to say, well, thanks, but we'd rather not have you in the building, if they feel that goes against their kind of internal processes for track and trace. Yeah, and there was also a question around, what kind of information can we ask them, and whether or not we can insist on an answer, which obviously we know that you can't, but if people are willing to give that up, then that is okay to keep that.
Okay. Thank you. Phoebe, do you want to go next?
Yeah, so mine and Julie's group had a really good discussion around actually a bit more information could be given and guidance from government on how track and trace actually works. And we'd had somebody who'd gone through the process and had sort of found that it wasn't necessarily the tightest in terms of making sure that all the mitigations that could possibly have been identified were done so. And also some guidance around how the vaccine rollout is going to affect track and trace. So in the future, will the process stay the same, or how will that be affected? Is there anything else, Julie, you want to add?
Thank you, Phoebe. So unless anyone else has anything on track and trace, should we move on to employee policies? What else came out around that? I'll start with Julie. I always start with Julie on this one, being the expert.
We talked about payment for people who are self-isolating, and some companies obviously class that as sick pay and they'll be paid under their relevant sick pay schemes, but there was some concern about whether that would eventually be open to some abuse, because people have a cough and a cold, they'll just phone in sick and say, I've got COVID symptoms. And there's that really hard balance, isn't there? Because we don't want to encourage people to come to work when they're sick, but equally we want to make sure that people are, aren't abusing that process. So there's that balance about what perhaps we could do to sort of level the playing field a little bit and encourage people to stay at home if they're sick. And there are also some, employers who don't pay sick pay. So that would be an issue again for staff in that regard. So we talked quite a lot about sick pay policies. And we also talked about holidays. Obviously, a lot of people have sort of deferred their holidays. And as soon as we're able to start traveling again, there's going to be a big rush of staff looking to take the holidays, and how employers are going to manage the disappointment, because not everybody is going to be able to take the holidays. And we talked about different ways that they, people have managed that. So really interesting discussion around those two issues.
Thank you, Julie. That's really useful. Did any they're the issues that I always hear coming up from members. Rachel, did you want to add something?
Yeah, I actually had a question from someone in our group, specifically around those holidays, Julie, if you could answer it. It was about the legislation amendment that carried for, the carry forward of the holidays. And 21 holidays can be transferred, holidays in 2020 can be transferred into 2021 and can spread over 2 years. But can 2021 holidays be extended into this year and the next year? How long does it go on for?
Yeah, it's for 2 years. Yeah, so it'll happen for 2 years.
So they'll be able to spread them over the next 2 years, or will holidays, potentially not used this year, be able to carry next year?
I think the regulations say that for the holidays accrued in the current holiday year, you'll be able to take those, carry them forward into the next 2 years. So I think it's a 1 year rule that applies for the next 2 years.
Okay,
unless it's
right.
Yeah.
Thank you.
Not everybody's holiday years are the same either, though. So some people are January to December, some are April to March.
Any of the other moderators have some more to add around employee policy? Anything that came up in their discussions?
Yeah, we had some really good discussion on the people policy piece. Really good of sharing a best practice between different types of offices, so people with large open plan offices versus smaller offices with perhaps only a couple of people. So it's really great to hear the differences between those and what best practice they already have in place. We also had a really interesting conversation around the split of holiday versus work from home to do your self-isolation period if you've had to go off island. And one of the points that got picked up was, you know, work from home shouldn't be seen as a negative. If that is seen as, you know, not as good as being in the office, then, you know, perhaps that is an issue with your working structure rather than, you know, an issue with somebody being allowed to use work from home during their isolation period. And it shouldn't be used as a punishment that, you know, you have to utilize holiday if you can effectively work from home. It was an interesting angle that, you know, I don't think had been considered in a previous workshop.
Thank you, Abby. That's great. Really, really interesting. Anyone else?
Can I just add something on we had some good questions around the 7 to 10 day rule, and people returning, and what companies' policies would be, obviously, after the 7 days. Will they still require, you know, will they put some policies into place that doesn't allow employees to come into the office or use communal areas or all that type of thing? And the discussions that took place sort of mentioned that it's easy for people where they can work from home, but when they're in a customer facing role and they can't allow people to work from home while they're isolating, that's slightly more difficult, and they might have to refuse holidays if that can't happen. So just around that change, really.
Great, thank you very much. Thank you. Anything else around employee policies? We should move on to, if we move on to office policies as well, and anything else may come up. So what sort of discussion did we have around office policies? Any best practice shared? Abby?
Yeah, we had some really great best practice from Jill from Barclays. Around, you know, their setup of social distancing already, so, you know, moving desks so they're at least 1 meter apart, so, you know, even if there is some sort of level of transmission in the office, it's really reduced. It's kind of built for the future rather than, you know, going back to old ways of working and then having to change it up. So it's kind of future proofing that layout of desks. And also, you know, still having people work from home, you know, they might have 60% in the office and 40% out, and rotoring to kind of manage risk as it is at the moment. And you know, staff choice as well is a really, really important one, speaking to your staff and understanding what they're comfortable with. So that was really, really fantastic to hear that as well. We did have a question around, you know, at what point would government mandate work from home again? I don't think it's something we can certainly answer now, but, you know, we did refer back to the different levels that were published in the exit framework, and, you know, the importance of you know, developing your own internal policies as a response to each of those levels, and making sure that staff know, you know, exactly, you know, what situation would mean work from home, and going by those levels rather than going by cases. So that was a really great chat as well.
Yeah, Abby, thank you for that. And if it helps, just for people to understand, so from a Chamber and an Eagle Lab perspective, obviously we manage an open co-working space with lots of events and meetings. We've had to think about how we mitigate against that, and what we're planning to do is to wrap our policy around the government's response levels. So, you know, when we're on response level 0, the Chamber and the Eagle Lab will do this. When we move to response level 1, this is what will happen. Response level 2, this is what, you know, we would then close it to the public and not have meetings. So, you know, and actually what we plan to do is actually publish that, stick it on a big poster, stick it on the wall, so that people are really clear what's going to happen as and when we move through the process, and we will map ourselves against the government's response levels. One thing that's come up a little bit from my members is that what will trigger those response levels. So, you know, what would have to happen for us to move to level 1 and 2, but it's my understanding that there can't be any clear sort of numbers, and, you know, we can't put numbers on that or data on that, because it's all very much guided around the hospital, or how virulent the virus is, that particular one. Is it spreading quicker? Is it harsher? Are people more ill? Is the hospital being overwhelmed? And I know the health minister mentioned that the other day, that we could have 20 cases, but they could be very serious. That would move us to level 1. Or we could have 400 cases, but everyone's doing okay and the hospital's doing okay. So I think we need to sort of help businesses understand that the response levels won't shift with fixed data and numbers. Would you agree with that, Tim? Have I got a good understanding of that?
Yeah, absolutely. It's based on where we are in terms, and the situation is about us getting parity with the UK now, and that very much lies on. We were talking about sort of in our session about quarantining and how that will work, depending on what levels we are, what people want to go away on holiday, all that sort of stuff, and balance. But that will change as we move into line with the UK and their procedures. So yeah, you're absolutely right. The next couple of months will be challenging. We will see some change, but hopefully we can get through this stage and into the next one. That's exactly where we need to be now. So yeah, that's right, thanks.
Thank you, Tim. Does anyone else have any more, really poignant areas that were discussed within their groups that they'd like to cover? Kiri?
Our group, touched on all the risk assessment side as well, obviously of this one, and just being very prepared. There was some really good stuff in regard to that. There was an interesting point actually for businesses that have employees that actually then work in other premises, and actually making sure that they've got policies in place for their employees when they're working in other premises, and actually where does that responsibility end and the responsibility of the business that they're working in then start. So that was quite an interesting discussion that we had as well, with regard to ensuring your employees are comfortable for working within that environment and in a different premises, where they come, potentially coming under somebody else's responsibility or somebody else's risk assessment as well.
Yeah, thank you, Kiri. That's a really good point, actually. Very good point. Everybody's situation is different, and yeah, they may split themselves across a couple of different types of environments. So therefore, they have to take that into consideration. Anything else, anyone?
Just following on. Sorry.
Go on. Rachel, go ahead.
I was just going to say, Peter raised a good point, and we spoke about mitigation practices at the moment. Now we're in this stage. And how that can impact track and trace's response. So you've got really good practices at the moment, that the implications and what happens to the whole office might not be so severe if you've got those in place now. And so I think that was a really good point, and allow people to go away and really consider how important right now is too.
Yeah, thank you, Rachel. Absolutely. Julie, did you want to mention something?
Yeah, just actually follow on from what Rachel said. It's about how the vaccination programme will impact on track and trace. And I think the other point we talked about liability, and in that if you're going into other people's premises, where the liability sits. And we talked about insurance companies and how they might respond to that. And we don't have any answers, but it was an issue we talked about as well.
Right. Okay. So what we're going to do now is spend quite a lot of time gathering all the discussion that's taken place today. Also, we had some brilliant questions put through all the Slidos prior to the workshop. Some of those questions may have been answered and some of them may not. So we will ensure that everything is gathered, collated, and we come up with sort of some key findings from these workshops. Posted 2 workshops today, sort of focused around the office environment, businesses in the office environment. And we're hosting a workshop tomorrow that's a bit more focused around customer-facing businesses. We decided to split those out because obviously they have very different needs. So all that leaves me to say is just thank you very much to Kevin Wilson, Julie Bradley for presenting, and all the moderators here for taking the time to work all this out with us, and obviously to the participants for taking part and sharing any best practice and discussion. We will follow up. I have popped a link in the chat. I hope you can see that. That's just a kind of a live link document that contains loads of useful links, various resources and guidance that's available already, because there's a lot out there. It's just thought it'd be useful to pop it all in one area. I've also popped Julie's slides on there. Hope that's okay, Julie. Please, obviously, any other comments, questions you have, filter them through to me and I can push them out. And we will look out for some follow-up and some feedback. And we will follow up with FAQs, answers to questions, and as much guidance as you need. You may well see, we may decide to run more of these sessions, you know, if we feel that it worked well, but I'll send out a follow-up and we'll see how we get on. So thank you very much to everybody. I'm going to end the session now, and I'll speak to you all soon.